Bill and Melinda, thank you so much for joining us on OZY. Really appreciate having you two together. You brought together a number of kind of innovators in the healthcare space, the Global Partners Forum, over 1,000 people. What's some of the best science that's come out of this group that suggests good things going forward?
One of my favorite examples is we work quite a lot in this contraceptives field, because if a woman can have a contraceptive, she can decide, be educated about it and decide voluntarily to take it, and she can count on it being at the healthcare center. It changes the trajectory of her life and her child's life if she can space the births of those children, because she will tell you she can feed them and she can educate them then. We have to get all of the levers right. We have to get the great new science out there, we have to get it delivered, and then we also have to educate people on the ground about what's available so they come in and demand the services.
Well, new vaccines are quite magical. If we can make them cheap enough, if they have enough impact, actually requires incredible science so that you don't have to keep it refrigerated or you don't have to use some complex needle delivery system. Even in the reproductive health space, if you get an injection that avoids you being fertile for a few months, now if we could extend that to 6 months, or the woman herself can just store the injection and then self-administer. And so ease of use, we've got a huge pipeline of great new innovations coming along. Good new science times delivery quality equals impact.
Let me turn actually to some of the critiques. Some say when someone is wealthy and as well connected as you guys are making such a difference, there's not as much accountability, that you're ultimately changing health systems, sometimes changing education systems, but that the ability to hold you accountable in the way that you hopefully be able to hold a government or some other entity accountable is limited. What do you say to those folks?
Well, none of the areas that we work in are we the primary funder. These primary healthcare systems have to be funded by the big country donors or by the local resources. So what we come in and do is we allow for new approaches to be piloted. We allow the government to bring in more sophisticated analytics than they would have had before, and they can look at the evidence. These pilots will only endure if the government, through its democratic processes, really says, wow, that works.
We're always looking for how do you push on those systems in the right way, with data, with innovations, with models from around the world, with trying new things, help them learn models that have worked around the world, we'll put in grants to try and make that primary healthcare system function much, much better. But we're always cognizant of the fact that what is left, if they don't own it, it's not going to be sustained well beyond our lifetime, and they're not going to get the change that they want.
But if someone were to push back on that and say, but the reality is in a place like Ethiopia, you may work with someone who's not a democratically elected figure, or at least may not act as democratically as people might hope. What do you say to that, where there's concern about the kind of leaders whose support you both may need and in the end may give support to?
Well, if you want to restrict yourself to well-functioning democracies, you should not get involved with poor countries. Poor countries are difficult, messy, complicated. All the countries we're working in are trying to get to a different place. They want to become middle-income countries with great democracies. And the deficits they have in terms of kids who are so stunted that they can't be educated, a death rate that means their population growth is going to be very, very high. And so helping them get rid of those factors, even when they're not perfect yet, is what will let them get to that place.